Dr. Tracy Oster, and I'm the Military Sexual Trauma Coordinator at the South Texas Veterans Healthcare System. April is Sexual Assault Awareness Month, and we wanted to start a video series to help demystify some of our services at VA called What to Expect from VA. You'll hear a number of different videos over the next 2 months pertaining to mental health. Today, our topic is what to expect when you endorse military sexual trauma and you would like to pursue mental health services. You can learn a little bit more about how to define military sexual trauma, or MST, as we will refer to it in this video, as well as how to endorse military sexual trauma at the VA during our last 2 previous videos. But today, we're going to talk about the mental health programs that are available to you if you would like to speak to a mental health professional. So once you have told a provider that you're interested in this, there are multiple different programs that are really great at VA for mental health. And we're going to bring in 3 of our program managers today to talk a little bit about these levels of care and what services you can expect. I want to welcome Dr. McLean, who is one of the program managers of our primary care mental health integration program. Dr. McLean, if somebody is referred over to PCMHI, what can they expect?
Sure. PCMHI is our mental health services that are embedded in all of our primary care outpatient clinics. If someone endorses MST, they can share with any of their PAC team members that they would like to see someone in mental health. One of the great things that we offer in PCMHI is same-day access to care. We can typically see someone anywhere between 0 and 30 minutes wait time for a same-day appointment. In that appointment, they would have a functional assessment intake that takes about 20 to 30 minutes. And in that time, we together will discuss some of the symptoms that they might be experiencing. And typically, these are a new onset of symptoms: trouble sleeping, falling asleep, staying asleep, or maybe trouble with depression or anxiety, things that they've never experienced before. And together we can create a treatment plan that same day, so when they walk out, they know what their next steps will be. We offer both individual and group therapy, and our teams are comprised of therapists, prescribing providers, nurses, technicians, and peer support specialists.
Thank you so much. We would like to welcome Dr. Steinberg, the BHIP program manager, to tell us a little bit more about what to expect at these programs. Dr. Steinberg, why would somebody be referred to a BHIP program or clinic?
Yeah, so BHIP, or our Behavioral Health Interdisciplinary Programs, are really for those veterans who have been experiencing some more chronic or perhaps more long-term issues that require an episode of care that's a bit longer than perhaps what we might see, for example, in primary care mental health integration. Looking at between perhaps 12 and 16 sessions of good evidence-based psychotherapy or group psychotherapy.
Okay. And for veterans who endorse military sexual trauma, what potentially could they expect for treatment?
Yeah, so within treatment within BHIP, we have interdisciplinary teams consisting of both psychology and psychotherapy providers, as well as with psychiatry and medication management providers, clinical pharmacy specialists, etc., who are able to collaboratively engage in a wide spectrum of mental health treatment options, which would include, of course, like I mentioned, psychotherapy, both individual and group psychotherapy, as well as with medication management options. So what we're really looking to expect from someone who's engaging in treatment there is to meet collaboratively for treatment planning with one of those treatment providers and engage with that entire interdisciplinary team to make sure that we're addressing the full spectrum of the needs that they have with respect to mental health.
Very nice. Are there group options as well?
Yes, there are group options in a wide range of presentations, looking at things like depression, anxiety, but also specifically for those veterans who have experienced military sexual trauma.
Okay. Thank you so much. I want to welcome Dr. Barron, who is the program manager of the PTSD clinic. Dr. Barron, why might someone who endorses military sexual trauma be referred to the PTSD clinic?
Well, one of the most important things to remember when it comes to the PTSD clinic is that what we offer is really focused on treatments that are specifically designed to reduce the symptoms of PTSD. Those symptoms might include nightmares, difficulties falling asleep, problems with anger or aggression, and difficulties engaging in activities that they used to enjoy, or otherwise isolating and avoiding things that might remind them of those triggers. As you mentioned in earlier videos, military sexual trauma is a definition and not a disorder. So not all veterans who've experienced military sexual trauma are going to meet criteria for PTSD. And for those veterans, our clinic is probably not going to be the most helpful for them in their recovery efforts.
So when you're referred over to the PTSD clinic, it sounds like you are ready and interested to start talking about trauma. What are some of the treatments that one could expect if they came over to the PTSD clinic?
Sure. So our clinic is going to focus on the clinical practice guidelines for PTSD with an emphasis on the gold standard treatments for PTSD. Most of those treatments are going to involve veterans being asked to talk about their trauma, experience emotions surrounding their traumas, talk about feelings and their reactions to those experiences. For veterans who've never talked about their trauma before, our clinic and our treatments can be considered pretty intense, so it is important that veterans are ready for this step in their recovery. Our treatments are also focused more on individual therapy, and they are time limited and structured. So that means that veterans may be asked to complete homework between sessions. They're likely going to be asked to meet with us weekly. We don't offer a lot of groups or supportive services, but those that we do are generally designed to really help veterans get through those more intensive treatment experiences.
Very nice. So coming in weekly, how long would you usually expect to be at the PTSD clinic?
Our treatments, in terms of the lengths of the treatments, might range from 5 sessions to 16 sessions, depending on the individual protocol that a veteran chooses with his or her therapist. The length of the protocols can actually range from 30 minutes to 90 minutes, so that's another important consideration in terms of time.
Very nice. Well, I hope that this has helped kind of demystify some of what these clinics do and what you would be expected to do if you decided to meet with a mental health professional. Thank you so much.